Mountains of Hope is our statewide cancer coalition serving all 55 West Virginia counties. Our mission is to facilitate and coordinate collaborations statewide and at the community level to address Mountains of Hope's designated priority areas. The vision is to reduce the human and economic impact of cancer in West Virginia. Mountains of Hope, or MOH, is made up of organizations and individuals in West Virginia like yourselves, and we even have some members from surrounding states. One thing we all have in common is that we want to be part of the effort to reduce the impact cancer has on the state. We have a wide variety of backgrounds and interest areas including state and local government, private and nonprofit organizations, faith-based organizations, health, medical, and business communities, academic institutions, researchers, cancer survivors, caregivers, advocates. MOH members meet at least twice a year for statewide meetings, once in the Charleston area and once in the Bridgeport area. Regional meetings will be scheduled based on availability and/or need. But most of our work of the coalition is done outside of face-to-face meetings by using conference calls, webinars, and emails. This allows people to be involved and engaged in activities even if they can't make it to the face-to-face meetings. Mountains of Hope is a collaboration of many people and groups. It is led by a steering committee with an elected chair, vice chair, and at-large members. There are also representatives from each of the 4 founding organizations: the West Virginia Cancer Registry, an appointed Agent of Hope representative, and non-voting members and coalition staff. Additional leadership is provided by the leader of each of the priority area work groups. The priority aims are chosen by the coalition membership. These groups will be explained a bit later. Mountains of Hope brings a variety of individuals and groups together to address cancer issues in the state. We have approximately 200 people who are actively involved in the coalition. The coalition encourages partnerships and networking and also looks for opportunities to work with new community partners. MOH empowers members to maximize scarce resources, identify gaps in services and resources, identify common challenges in the fight against cancer, and carry out activities to work on the cancer plan all over the state, especially in rural areas. Mountains of Hope is the author of the state's cancer plan and leads efforts related to the charges set forth in the plan. The West Virginia Cancer Plan was just updated for the 3rd time and will cover years 2016 to 2020. It serves as a blueprint to provide healthcare practitioners, policymakers, advocates, the public health community, and other stakeholders a common set of objectives and strategies designed to encourage collaboration. The steering committee reviews the plan every year to see if there are any major changes to the data that would affect progress and updates the online version annually. The plan is updated every 5 years. Key objectives and strategies are identified ranging from prevention, early detection and treatment, to survivorship and end of life. When possible, strategies come from existing evidence-based guidelines and best practices and are linked to specific and measurable objectives. The plan is written to be a usable, living document that doesn't just sit on a shelf. It was written so that anyone could get involved. Pages 8 and 9 have examples of how different people or groups can help address the issues in the cancer plan. The plan is structured to have 5 overarching goals, 25 aims, with measurable objectives and strategies under each aim when appropriate. You are encouraged to download your own copy of the plan. A link will be provided at the end of the presentation. The 2016 to 2020 West Virginia Cancer Plan is based on the following 5 overarching goals: prevent cancer from occurring, detect cancer at its earliest stages, treat cancer patients with the most appropriate and effective therapy, improve the quality of life for every West Virginian affected by cancer, achieve health equity across the cancer care continuum. The goals of the cancer plan were written to cover the entire range of cancer care. Prevention, to take steps to prevent cancer whenever possible. Early detection, We encourage everyone to keep up to date on their cancer screenings and to listen to their bodies. Talk to their doctors if something doesn't seem normal. We want to find cancer as early as possible when it is most treatable. Treatment. We want everyone who has cancer to get the best treatment, to have access to clinical trials, and to receive the services that will help them and their families during cancer treatment. Survivorship. We want cancer survivors, including their families and support network, to have access to survivorship, end-of-life care, hospice, and other emotional and social supports. The goal of the plan is to support and address issues related to cancer, no matter where in the circle they are at any given point in time. The circles don't overlap for a reason. Someone may first enter the cancer circle in survivorship when supporting a loved one going through treatment or after treatment care. Or another person may enter the circle in early detection when they go for a cancer screening, never having thought about cancer prevention before. The Coalition has picked 7 aims to work on through Coalition activities for the next 2 years, 2016 to 2018. This does not mean that other aims will not be addressed. The 6 work groups will focus efforts on 7 aims selected as priorities. They are: Aim 8, reduce the use of artificial ultraviolet light for tanning. We want to reduce the use of tanning beds and to change the law allowing children under the age of 18 to use them without parental consent. Aim 10, increase the immunization rates for vaccines shown to decrease the risk of cancer. We want to promote and encourage young people to get the HPV vaccine to prevent cervical cancer and increase the number of newborns who get the hepatitis B vaccine. Aim 11, increase risk-appropriate screening for colorectal cancer. This means that we help people understand their colorectal cancer screening options. These include stool-based tests done at home or tests to view the inside of the colon done at a medical facility. Aim 14, increase risk-appropriate screening for lung cancer. Lung cancer screening is new, so we want to educate people on who is eligible to get the annual screening and help them find where they can go to get it. Aim 17, increase participation in cancer clinical trials. Clinical trials are cutting-edge treatments. We want to let people know that they are available in West Virginia and help squash the myths that surround trials in general. Aims 20 and 23, improve the quality of life for cancer survivors in West Virginia and increase utilization or use of hospice care. There are a lot of services available that are not being used. We need to work on getting the word out there that they are available. If you are interested in finding out more about the efforts of these work groups, please contact the Coalition. Contact information will be listed at the end of the presentation. In the past several years, Mountains of Hope has engaged in a wide variety of activities to help decrease the impact cancer has on the state. A few examples include: since 2012, Mountains of Hope has distributed 36 mini-grants to implement activities at the local level. There have been different visual projects, including these posters, "If you're tanned, you're toast," that were given out to schools and other organizations across the state. We worked with the American Cancer Society to host a colorectal cancer summit to talk about how we can meet the national goal of 80% by 2018. 80% of eligible people get their colorectal cancer screening by 2018. West Virginia Governor Earl Ray Tomblin was the first governor in the United States to sign the 80% by 2018 pledge. Other items include a PSA about skin cancer.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and 1 person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org, a message from the American Academy of Dermatology.
And one about colorectal cancer, featuring country music star Kathy Mattea, a West Virginia native who lost her father to colon cancer.
Hi, I'm Kathy Mattea. A few years ago, we lost my dad to colon cancer. And when he got diagnosed, we were all really surprised because he was a health nut and went for a physical every year on his birthday. But he never got screened for colon cancer. So as he got sicker, he pulled me aside one day and he looked me in the eye and he said, I want you to promise me that you'll go get screened. And if it hadn't been for that promise, I don't think I would have gone. As it turns out, when I got in there, they found a couple of polyps and they removed them on the spot. So because of that screening, I could very well have a longer, healthier life. So if you're over 50, don't wait. Have yourself screened for colorectal cancer. The procedure is really no big deal, but the results could literally save your life. And that's a really big deal.
These are just a few of the many projects the Coalition has been a part of over the past few years, and there is so much more that we can do, but we need your help. Now that you know a little bit more about the Coalition, we encourage you to join. It's free. Remember, the cancer plan was written so that anyone could use it to get involved. The handouts provided give examples of how different people or groups can help address cancer issues. There is no excuse not to get involved in some way.